A very good afternoon, my dear students. Once again, I am Dr. Rajsri here. Today, my topic is Family Adoption Program. Here, I will discuss about the family, what is Family Adoption Program, what you have to do in the field visits, what's the motive, what's the targets, and what's its objects, what is the aim, everything I will discuss. Okay. So NMC, you know NMC? NMC in various years they used to upgrade their setting and programs for maintaining the higher standard of Indian medical education. So in few years they introduced family adoption program in community medicine which become mandatory from the first year itself. Okay. So here in introduction, a majority of the population, around 65.5%, residing in rural areas. But the good setup of healthcare always we get in the urban area. Okay. In Alma Ata Declaration, it was held on 1978 on 12th September. Here, health for all. These were accepted by all developed and developing countries in the world, and they decided to achieve the goal by the year of 2000. Okay. So, health is a human right. So, we needed to achieve health for all. So, what do you think? Um, the main barrier in the rural area is illiteracy. Okay, illiteracy money they don't know about the disease, the symptoms. They are suffering for many days, many years, and they don't know when to seek the treatment, when to go to healthcare workers. So the ignorance about the disease, okay, and the distance take time off from their daily wages work. So what is the aim? The aim is to provide experiential learning opportunity to Indian medical graduates, community-based healthcare, and thereby enhance the equity in health. বুঝতে পেরেছিস? এটা কি হচ্ছে? The provide experiential learning opportunity. তোরা এক্সপিরিয়েন্স করবি যে কি করে আমাদের কমিউনিটি বেসড হেলথ সিস্টেম, আমরা কালকে যেরকম গেলাম পিএসসি সিএইচসি তে গেলাম, ওইখান থেকে বিভিন্ন রকম জিনিস তোরা এক্সপিরিয়েন্স করবি, অ্যান্ড ইউ উইল গ্রাজুয়ালি লার্ন হাউ টু এনহ্যান্স দ্য ইকুইটি ইন হেলথ. ওকে, now what are the objectives of this program? কি objectives আছে? There are 5 objectives I mentioned here. The main is orient the learner towards the primary healthcare. You people are the learner, you will get oriented towards the primary healthcare. Okay, create health related awareness within the community. You will go to the field and you will talk with the people here, and you will make them more conscious about the disease, any disease. We already discussed communicable, non-communicable diseases, various type of diseases. So we will make them aware, make the community aware about different types of diseases. Okay. Function as a first point contact. You people will be the first point contact. You will go to the family and the family member will share their experience. You will be the first contact. Okay. তো কি অবজেক্টিভস থার্ড পয়েন্ট চলছিল, একটা চলছিল ইউ উইল গেট ওরিয়েন্টেড, তো ইউ উইল মেক কমিউনিটি অ্যাওয়্যার, অ্যান্ড দেখো হচ্ছে কি না, অ্যান্ড ইউ উইল বিকাম দ্য ফার্স্ট পয়েন্ট কন্টাক্ট অফ এনি ডিজিজেস, and you people are the channel between the community, okay, and the health facility. Because you are under a medical college and a hospital will be attached to the medical college. If any problem, any medical illness you find out in any people, you will ask the mentor who will be there with you, and you will try to get them, provide them treatment or advice, and you can seek uh, help from the Department of Pathology, Physiology of your colleges. And then we have already discussed there are different types of এসছে তো এরকম মহলা কেন ফ্রেশ আসছে ওকে দেখা যাচ্ছে হ্যাঁ ওকে act as a conduit between the population and relevant healthcare facility. Okay, then generate and analyze the related data for improving health outcome and evidence-based clinical practice. এটা কি বললো? Generate and analyze the data. The first year, in the very first year, you have to collect the data. Data collection is a vital point in family adoption program. Mane, you will go and check the vitals, and you will collect the different type of information from the people, and then you will note it down and make a data system in your notebook. So gradually you can analyze that after the treatment this portion of people become healthier, and these people become more sick. Okay, this will make you analyze and related data improving the health outcomes, evidence-based clinical practice. The target in the first year, what is the target? Learning the communication skill. You will go to the society, you have to learn how to communicate with the general people. Okay, it's the basic and the most important skill of our profession, that you have to communicate each and every people uh, of the family which are provided in the uh, program. Understand the dynamics of the rural setup region. Rural setup region dynamic कुछ अलग ही है, because here you will get to know beside the allopathic and modern medicine, they used to manage their problems in differently. Okay, they you will get to know how they become more and more क्या बोलते हैं ना, सुना है कभी झाड़ पोक कर लेते हैं. So we will share our knowledge, being an allopathic doctor and a healthcare professional. We will spread our knowledge how to get rid of these problems. The dynamic of rural setup region, screening programs. So yesterday you saw that there are different type of programs are going on in PHC sub-center setup, which are sponsored by the central government and state government. So if you go to the community health center and community as well, you will get to know the about you get to know the programs. Okay, then learn to analyze the data collected from their families, and you will eventually learn how to identify the disease, the illness, and the families you are allotted. In the first year, you have to develop communication skill, understand the dynamic of the rural setup, screening programs and education about ongoing government-sponsored health-related programs, learn to analyze the data collected from their families, and identify the disease and the illness and the malnutrition of the allotted families, and try to improve the standard of the people living in rural areas. Okay, and what is the target in the second professional year? In the second professional year, inspire active participation of community through families allotted, and continue active involvement to become the first doctor reference point of the family by continued active interaction. Start compiling the outcome targets achieved. Okay, so in the second year, you should be more interactive and make the community more sensitive towards your work. Okay, that's it. And the third professional year, analysis of their involvement, and impact on the socio-economic, political dynamics in addition to improvement in the health conditions. So in final professional year, prepare a report to be submitted in the department addressing improvement in general health, immunization, sanitization, de-addiction, improvement in anemia, tuberculosis, control, sanitization. I have already mentioned in previous classes also. Same topics, same things are coming. So basically, you have to take care of every single thing. Okay. So total duration 27 years in each uh, year. So in total 18 1 hours are spent in family adoption program. The process: every new batch allotted a village not covered under RHTC, Rural Health Training Center. Okay. Every new batch allotted a village which is not under RHTC, an average of 5 to 7 household minimum. You can get more also if you are interested. Okay. Minimum 5 to 7 household every student. Okay. Then assistant professor SR will mentor 25 students. Okay. What is the process? So, in the first class, when you go for any field visit, introduction to the families by the mentors. Mentor will introduce you to the family members during the induction course. In the induction course, a special visit may be organized twice a week, deciding suitable time with the village head and mukhia. Introduction of village outreach, FAP, Family Adoption Program, should be done by addressing Gram Sabhas, head of the department, senior faculty, and medico-social worker. Sensitize the villagers and gain their acceptance and confidence. Oh, একই কথা, সব কিছু. Data to be collected. So, on the very first day, when you are allotted in a family, after introducing with the members, so you have to collect their height, weight, vitals. What are the vitals? Can you tell me? What are the vitals? What? Mm-hmm. Uh-huh. Acha. Vitals means blood pressure, respiratory rate, pulse rate, টেম্পারেচার এগুলি আসছে ঠিক আছে তো ভাইটালস height weight vitals oral hygiene status of every member must be recorded in the first month of the visit. Okay, in the second month we will measure hemoglobin, blood sugar level, and urine dipstick. Hemoglobin for detection of anemia, blood sugar if she or he is having diabetes or not, urine dipstick for any to rule out any kidney diseases, UTI and all. And support from the department. I have told you can seek support from the Department of Physiology and Pathology, okay, to carry out this test. These data be updated every year. You have to update the data every year. একটা ফ্যামিলিতে যাচ্ছিস on the next year if you are attending this family you will rewrite the data and all, you can see the difference. Okay, vaccination program also be included in the data. If there is any pregnant woman in the family, if there is any adolescent girl, okay, if there is any baby children is there, you have to mention what the vaccination which vaccine should be given on that time. Okay, so you have to mention in the sheet. Data to be collected, student primary contact in case of medical illness. Okay, so when you attend a family, if there is any illness, say you attend a family and someone is telling I am having the symptoms watering of from my breathlessness, so you are the first contact, right? You have to note it down, a case of any medical illness or any emergency. Okay, so student Intern should consult with her mentor. Okay. The hospital to which the college is attached must provide treatment. Okay. And the facilities to the patient. Government schemes may be utilized for optimal management. The government schemes and programs may be utilized for optimal management. Follow-up record must be maintained. After the treatment, you should follow up the patient. Okay? How much he or she is recovered, and you should mention in the sheet. This must be periodically evaluated by mentors with the help of senior resident. Okay? You got it? Clear? Okay. Follow up. The entire data sheet may be prepared by every student and it is submitted by the end of 6 sem. By the end of 6 sem. Progress note must include every demographic point and history recorded. This should include positive effect. Positive effect money. Positive effect from that is improvement. Positive effect means improvement. In sort of like lifestyle modification, de-addiction, okay. If he or she is not under proper vaccination schedule, she is taking proper vaccination, you can mention. Okay, these all are improvement. So, lifestyle modification, reading good books, sports, yoga activities have been included in the household. What is the impact? What is the impact? Improvement in health, including anemia, diabetes, hypertension, tuberculosis, okay? Then make them aware about sanitization. In rural areas, you will see different type of wells, how to protect them from various sort of waterborne diseases, okay, how to keep how to maintain proper sanitization, okay. The social responsibility, what are the social responsibility as a student? What do you think? I have already mentioned the social responsibility as a medical student to make them aware. First of all, make them aware regarding the good lifestyle, the proper health, what is the to maintain proper lifestyle, and to protect the environment also. Besides this, you have to protect the environment by planting different type of medicine plants and trees, make them aware of cleanliness, okay, and sanitization drives with the initiative of medical student in the household. Okay, got it. So what expected outcomes for the student? The outcomes of the students, okay. So what are the outcomes? The FAP is expected to own more communication skills, okay, which is the backbone of our profession. You will be learn more communication skill. Then learn to be human. Human means manobik. How to be more human. Emphasize with the rural population, understanding their customs. They have limitations. They have various type of limitation. You will get to know that some people will tell you that after 2 child, we will not do ligation, family planning. Whatever it will, God will give, we will continue. And some will tell you that yes, my family is complete. I will go for family planning advice. I will like it. I will use copper tea. Huh? There, in religion wise, region wise, there is some limitations you will get to know with after talking with all the community people. Okay, and many positive aspects of also of the community. The aim of imparting education to the students. What is the aim of imparting education to the students? Team leaders for healthcare. You will be the team leaders of the healthcare in future after MBBS, doing MBBS, and primary consultants in the primary healthcare also. Okay, then you will learn the basic skill to diagnose. If a patient come, you will learn the basic skills how to diagnose, and basic practical skill to administering IV fluids. I have told you yesterday that there is labor room also. If you get posting, if you do night duty, you will get to know, you will learn how to administer IV fluid, emergency IM injections, and drawing blood. Because sometimes, there is one sister with you and there is two emergency patient. You have to do you can't sit down and say, it's not my work, I can't do, I'm a doctor. No, no, you have to learn everything. You are the boss, okay? You have to learn. जो टेक्नीशियन कर रहा है वो भी मुझे सीखना है, जो सिस्टर कर रहा है वो भी मुझे सीखना है. आई हैव टू इन इमरजेंसी, इन एनी इमरजेंसी, हम लोगों को वो कंट्रोल में रखना है. ठीक है. बेसिक प्रैक्टिकल स्किल्स, जैसे IV fluid, medicine drawing, dressing of wounds, any dressing, any sort of dressing, sharp wound, blunt wound injury, this types of dressing. The practical field training from the beginning will make them better doctors. If you start learning from the beginning of your course, that is from this first year, importance in training in preventive medicine, knowledge of methods of implementation of various healthcare related scheme. Okay. So, okay. What are the challenges? What are the challenges? The final visit, end of the 3 years, should be recorded in with special program. Plan the longitudinal healthcare of the adopted families at the end of the student batch. No village is repeated under FAB. So incentives, presentation of the work at international forum. You can present your work in the conference also, and publications. Okay, award the students and your faculty. If you are a good student, you are working very actively, there should be a award. You should get an award. Logistic support for the visit by students, faculty, and other staff to this village provided by college. The conclusion is clear that the family adoption program to villages outreach needs to be adopted as a part of curriculum of MBBS students. Okay. So MBBS students as a complete doctor. After MBBS, you are a complete doctor. 19 subjects under your in the MBBS course, and you have to know everything. You are the boss in the primary health center. Okay. So you are a complete doctor with human approach. The approach should be human, and confidence to be leaders in socio-medical fronts. Okay. The neglected rural population will be enriched, and the result for the country will be seen in next few years. If you start working from today, you will see the result after few years, not today. Okay, these are written here. So it's basically very simple thing. Any query? So family adoption program, this is a orientation class. No need to write and no need to just listen. If you want, I can provide you slides also. Okay, no need to write. Okay. So in near future, I think your field visit will be started. No? Field visit. In field visit, there will be two centers, Jogendra Nagar sub-center, and another one is Kanchanmala. These two places, I think we will go and explore the village and their community. Okay, and we will explore the situation, how they are maintaining their health, the sanitization, their environment, everything. Okay, so in the field visit, we will gradually uh, learn how family adoption program works. Now only I have given you the overview of this topic. ठीक है? So it's easy ना? Okay? Very easy and very मजे की part है community medicine का. बहुत मजा आने वाला है. Okay? Thank you.